So guys, look at this question that they have asked here. Plasmapheresis indications. Okay. So they have asked for 3 marks. What have they asked? Plasmapheresis indications. So, what is plasmapheresis? See, plasmapheresis means plasma you're removing. Plasma exchange means you're removing and putting different plasma. But here they're asking about plasmapheresis. That means you're removing plasma. Why will you remove? Indications. One can be because you want to donate plasma. That will be one indication. The other one will be for because your plasma has all the bad things, okay, like toxins or some antibodies which are attacking you. So that time you will remove it. Okay, what and all are there? Toxins or some antibodies which are attacking you. So they want to remove it. So as a treatment. Okay. So plasmapheresis indications. One is what? You will say for donor plasmapheresis. Okay. First, plasmapheresis means what? Means you will remove plasma. Okay, that's what. You'll remove the plasmapheresis. But what is plasma? When you have blood and then you put an anticoagulant, okay, that means it will not coagulate. There is no blood clot here. And then you will centrifuge it. So that time all the cells will go and sit down. That means all your RBCs, WBCs, platelets, all that will sit down. Okay. So, and then whatever is left on top, that liquid is plasma. Plasma will have all your clotting factors like fibrinogen, etc. And it will have your antibodies. Okay. So your plasma has what? Your serum. That is serum plus clotting factors. Okay. So this also will have your antibodies and any other toxins can be here. Toxins, antibodies, clotting factors, all that will be there. So this one you will remove. When will you remove? When there is toxins in your body or there are antibodies that are attacking you. Correct? So now you understood the indications already. Or the other one indication is what? Donation. Okay. So there are two terms here, plasmapheresis, plasma exchange. Here in the exam they're talking about plasmapheresis, physical removal of antibody, toxins, etc. That is plasmapheresis. Okay. So either you can do for donation or for treatment. I already told you this. Now what are the indications? So guys, there are so many indications given in so many textbooks. First I will just show you everything. Just look at this. Transplant rejection, if an organ transplant, that person is rejecting, vascular rejection, then primary biliary cholangitis, Waldenstrom macroglobulinemia, plasma cell myeloma, earlier called as multiple myeloma, Kawasaki disease, if there's vasculitis, right, that Goodpasture syndrome, acute disseminated encephalomyelitis, Lambert-Eaton syndrome, that is myasthenic syndrome, systemic lupus erythematosus, again some autoimmune condition, antiphospholipid antibody syndrome, so anything antibody autoimmune conditions. Then pemphigus, because pemphigus, this is they are saying that it is caused by autoantibodies. Okay, so again, so autoantibodies means obviously you want to remove these antibodies, so you can use plasmapheresis. Okay, then you'll remove those antibodies basically. Then what are we talking about, guys? Plasmapheresis indications. There are so many indications. Autoimmune hemolytic anemia. Autoimmune, that's a condition. Guys, are you focusing? Okay, if there is some acquired disorder of coagulation like acquired antibodies to factor 8. So again, antibodies are attacking very good things. So then you remove the antibodies. You understood now, guys. Acute liver failure and Wilson's disease. Okay, you are going to do plasmapheresis combined with D-penicillamine. I think this is more like a toxin removal, I feel, right? Not an antibody removal, maybe. Then polyarteritis nodosa. What is this polyarteritis nodosa, guys? If it is associated with hepatitis B, then they are talking about plasmapheresis. Then if there is immune complex glomerulonephritis, obviously, right, this is immune complex glomerular nephritis. You want to remove the immune complexes. So simple. Plasma cell myeloma. What is this plasma cell myeloma? It's the same multiple myeloma, is it? Then I'll remove this word. Wait. Yeah, that's coming 2 times. So I'm removing the plasma cell myeloma. Okay. Don't scold me, guys. I'm just looking at so many textbooks and many textbooks, so many things were mentioned. Okay. Some nephrogenic systemic fibrosis. Again, you can remember something to do with kidney. Nephrogenic systemic fibrosis. Non-metastatic neurologic complications of a malignant disease. Okay. But this is a non-metastatic complication, neurologic complication of a malignant disease. Okay. Then multiple sclerosis. Okay, again autoimmune condition. Refsum disease, neuropathy. Okay, botulism. Again, this is toxin, right? So I'm thinking botulism maybe because of toxin. Then one more PlasmaPheresis indications. So many other. I'm telling you the last slide here. Or anti-neutrophil cytoplasmic antibody associated vasculitis. If you can remember, just some vasculitis which is antibody associated. Okay, you can remember that. Cryoglobinemic vasculitis. I think we already saw this somewhere, kind of cryoglobinemic vasculitis. Do you remember? Let's go and check. Some cryoglobin associated glomerular nephritis. Now they are talking about what? Cryoglobinemic vasculitis. Okay, then epidermolysis bullosa acquisita. Okay. Epidermolysis bullosa acquisita. Something to do with skin, right? This is acute idiopathic polynephropathy. You don't know why it happened at all. Sorry, neuropathy. Nothing to do with the kidney, guys. Neuropathy. So nerves are affected. Guillain-Barré syndrome or other inflammatory demyelinating polyneuropathy. So the nerves are getting demyelinated for some idiopathic reason or some inflammatory. Then they are trying to do a plasmapheresis. Myasthenia gravis, you know. It is autoimmune. Thyrotoxic crisis, thyroid storm. So I'm thinking they are doing the plasmapheresis to remove the hormone. And what about this homozygous familial hypercholesterolemia? This problem is with hypercholesterol. So will this plasmapheresis remove cholesterol? So removing plasma will remove antibodies, toxins, hormones, lipid. So nice, right? Okay. Then what else? So did you learn all the indications of plasmapheresis according to 3 different textbooks we have told you, right? Which and all textbook? Davidson, then Lange, then Alagappan, I think. Yeah. So all these textbooks we have read, and these are all the indications of plasmapheresis. Guys, when it comes to plasma exchange, right? This plasma exchange, when you want to put back some plasma, I think which will have some good thing in the plasma. These are the things which were mentioned. Some things are overlapping, like multiple sclerosis, plasma cell myeloma, right? Then Goodpasture syndrome, glomerular nephritis. Some things here and there I can see are overlapping. Okay. Then that's all I think we want to cover. Plasmapheresis indications. Mainly you talk about donation. For that also you'll do plasmapheresis for treatment of what? Multiple myeloma, that is plasma cell myeloma, transplant rejection, then primary biliary cholangitis, Waldenstrom macroglobulinemia, okay, and then in Wilson's disease to remove copper, in thyroid storm to remove the thyroid hormones, then some hypercholesterolemia to remove the cholesterol, etc., etc. Right, all the autoimmune conditions, systemic lupus erythematosus, myasthenic syndrome, myasthenia gravis, then what multiple sclerosis, antiphospholipid antibody syndrome, then vasculitis, then pemphigus, then you'll write, because pemphigus autoantibodies, something adhesion. Okay, then autoimmune conditions like autoimmune hemolytic anemia, then some coagulation factor autoantibody is there. Then glomerular nephritis because of immune complex, guys, nephrogenic systemic fibrosis, then some malignant diseases also they're talking about, then refsum disease, botulism, then what else? I'm just revising, guys, take it easy. Vasculitis, all the autoimmune ones, epidermolysis bullosa, polyneuropathy, Guillain-Barré, any other demyelinating neuropathy, myasthenia gravis, we told you, thyrotoxic crisis storm, hypercholesterolemia, homozygous familial. Okay, that means this guy homozygous familial means problematic, right? Okay, so plasmapheresis. So that's all, guys. Plasmapheresis indications you will write in the exam and get 3 marks. Bye bye.